We are currently located at Samaritan Medical Center, so we're not on Fort Drum, but we do offer multiple different women's health services. So that includes birth control counseling, infertility workups, family planning, also general GYN problems such as PCOS, menopause, wide range of variety. So that's to the general gynecological services. However, we also still do provide obstetric services, so outpatient services to include low risk and high risk pregnancies. So we start those outpatient pregnancies, and then later on, currently in the pregnancy, we are deferring to network just because we are not doing labor and delivery coverage at this point. We actually support all of Fort Drum beneficiaries, TRICARE Prime particularly, and active duty. Now, TRICARE Select do have the potential to come see us on space available basis, so that is still potential to come see us at our clinic. Unfortunately, we do not see any Martins Point beneficiaries. So as far as gynecological services, just visiting primary care provider, and they will place a referral to our clinic. Once it gets over to us, we'll approve that, and our front desk will call you and schedule those visits, so you don't have to give us a phone call. Now, if you're pregnant, or if you're unsure if you're pregnant, that's just a walk into the laboratory up at Guthrie, leaving a sample. If it's positive, you'll get a phone call from primary care, and they will put in that referral to come see us, and then we'll give you a phone call to start those visits. We're referral only, so it's not a walk-in. There are locations where you can do those walk-in visits for STI testing, or if you do want walk-in birth control, we do have a walk-in birth control clinic up at Guthrie. So we actually full service. So when we first call you and trying to determine when you're due, we do set up that very first ultrasound anywhere between 7 to 10 weeks, and that will be done actually in our clinic. We do a full medical history review and a physical, make sure if there's any type of risk factors for the pregnancy, and then making a plan individualized to each person for the pregnancy. We typically see obstetric patients about monthly until about 28 weeks, and they're pregnant, and then more frequently after that. As far as lab work, radiology, formal radiology, all of that is done up at Guthrie, but we do review those results here with us. So unfortunately, there are not very many providers to really adequately cover what we need in women's health across the country, and that includes the military services. So that's hit us here. So right now we don't have enough physicians to adequately and safely provide inpatient care. So until that happens, we are providing that outpatient care. We do have women's health nurse practitioner, certified nurse midwife, and physicians available. And then we see you during all your pregnancy, set up that plan of care, and then assist in transferring you to one of our civilian partners in the network. We do all the transfer of records, and then they call you with an appointment. That allows you to set up care with who is going to do the delivery in the third trimester, especially when those risk factors do have a higher potential to come about. And then delivery would be at one of our local civilian hospitals. So if you are already set up in the civilian network after 28 weeks, typically you'll go back to see them for postpartum care. But if you started your care with us, you can also give us a phone call for that postpartum care, especially if you went home to deliver. You can still come back and see us. We are not closing. We're not going away at all. This is a very large post. It's a young post. So our services are really needed up here in North Country. So we're not going anywhere. We might not be doing labor and delivery right now, but we're still providing all those other services that we have. So we had a program, group prenatal care, called Centering. Unfortunately, we had that downsize of providers, so we are not currently providing it, but there is an opportunity to restart that. So for obstetric care next year, doing that group prenatal care provides some social support to our families and pregnant soldiers, and also it does provide some prenatal education as well. So something to look forward to next year. In addition, we actually do have one of our nurses who is an international board certified lactation consultant. So if there's any tricky breastfeeding questions, those referrals can also be placed to us as well, and we'll see what we can do.